Good evening everyone. Today we are going to see the case study of prostate hyperplasia. So the scenario is a 74-year-old male presented with the complaints of increased frequency of maturation associated with poor stream and urgency for the past 1 year. Now, how will you manage this patient? This patient having a urinary problem. So, if it is a benign hyperplasia. Benign means non-malignant, that is non-cancerous. Hyperplasia means the overgrowth of the cells. So definition of hyperplasia is benign hyperplasia enlargement. Prostate is a prostate gland resulting from an increasing in a number of epithelial cells and stromal tissue and developing upward into the bladder and obstructing the outflow of the urine. This is called benign prostate hyperplasia. So, what are the etiological factors for benign prostate hyperplasia for men is idiopathic, which means unknown causes. But some of the reasons we have found, that is aging along with the endocrine factors, accumulating of dihydroxytestosterone, cancer of prostate, other obesity, inflammation, moderate alcohol consumption. These are all the etiological factors for a benign prostate hyperplasia. And the pathophysiology is due to etiological factor like aging, which leads to decreased testosterone level, which leads to testosterone converting into dihydroxytestosterone, which leads to accumulating in stroma cells of prostate, which leads to enlargement of the prostate, and which leads to obstruction in the urine flow. So patient having the urinary incontinence or retention like that. Urinary incontinence means they feel urge but they can't void the urine. Incontinence means they can't control the urine. They feel very urgency from the urine. And then we are going to sign and symptom, which is clinical manifestations. The obstruction and irritation symptom complex, which includes increased frequency of urination, nocturia. Nocturia means the nighttime mobility, urgency, hesitation in the starting urination, abnormal straining urination, decreased in a volume and stream of urination, interruption of the urine stream, urine dribbles out after urination. A sensation that the bladder has not been completely emptied, acute urinary retention when more than 60 ml of urine remains in a bladder after urination, and this is urinary incontinence. And recurrency urinary tract infection, generalized symptoms like anorexia, nausea, vomiting, fatigue, epigastric symptoms. These are all the common symptoms for the benign prostate hyperplasia. And then we are moving to the diagnosis now. How will we diagnose these conditions? The first method is history collection and physical examinations. History collection about the family history, past history of these patients, regarding any surgeries in the male reproductive organ, or some alcoholic consumptions, that personal history also. And physical examination means we can see the bladder by palpations whether there is any tumor or not. And then digital rectal examinations. DRE means digital rectal examinations. And another one is urine analysis with culture. We know about if any infection is there, if it is like that, the urine has some amount of pus cells, that means bacterial cells. This is due to some of the infections through intercourse, poor hygiene, or common toilets like that. These are the common symptoms for urinary tract infections. Another one is serum creatinine, because if any renal impairment is there, it will cause the prostate hyperplasia. So serum creatinine. Another one is prostate specific antigens and transrectal ultrasound and cystourethropy. So these are all the diagnostic techniques used to rule out the benign prostate hyperplasia. And then one is management. Now the first goal of collaborative care of restore bladder drainage, relieve pain symptoms, prevent and treat complication of the benign prostate hyperplasia. The medical managements are alpha blockers, which is used to relax the muscles in a prostate gland. Another one is anticholinergics, which is used to relax the bladder if it is overactive, and 5-alpha reductase inhibitors. The combination therapy of alpha blockers and 5-alpha reductase inhibitors. Another one is tadalafil. The medicine is used to treat erectile dysfunction and diuretics. The surgical procedures are transurethral resection of the prostate. A thin tool with a light called the scope is inserted into the urethra. Remove the outer part of the prostate. TURP often relieves symptoms quickly. Some patients have a strong urine flow soon after this procedure. So this is the transurethral resection of the prostate. Another one is transurethral incision of the prostate. A light scope is inserted into the urethra and made 1 or 2 small cut into the prostate gland. This makes it easier for urine to pass throughout the urethra. TUIP might be an optional for the patient having a small or slightly enlarged prostate gland. And another method is transurethral microwave thermotherapy. So this is the microwave energy from the catheter destroy the inner portion of the enlarged prostate gland. It shrinks the prostate and it eases the urine flow. Another one is laser therapy. There are two types. One is ablation procedure, another one is enucleative procedures. And prostate lift and embolization. And water vapor thermal therapy, robotic water jet therapy, open or robotic assistant prostatectomy. These are the some of the different type of procedures for a benign prostate hyperplasia. Thank you.